So I think the main thing that I've noticed that the Great North Record will really help with is particularly accessing patient records out of hours. So previously in hours it wasn't a problem, we could ring up a GP and get information about the patient's medical records, but out of hours it was a real difficulty sometimes finding out key information such as what medications the patient was on or an operation they'd had done recently in another hospital, and we just didn't have access to those records. The Great North Care Record will really help that. It will mean that we can see exactly what is going on with a patient at any time of day or night. Currently we get a patient who might have been to an A&E department elsewhere in the region, and they might come to us that very same day and we can't see their record. We can't see what tests they've had done that day elsewhere. Again, that would be really helpful if we can see that, and we can see the discharge information from that A&E. That will really help us. So having access to particularly the tertiary hospitals that we're referring to into Newcastle, we have lots of tertiary services, neurosurgery, renal, cardiothoracics, oncology in particular. We end up seeing a lot of patients who are known to Newcastle teams already, and we can't currently see outpatient letters or investigations that they've had easily. The Great North Care Record will give us access to that. We'll be able to see outpatient letters, and it will give us an awful lot of very useful information that currently we just can't see at all. So it will really help us.